Ever heard of osteomyelitis? It might sound like a mouthful, but it's essentially an infection that can take place in our bones. Picture this: bacteria or other germs hitch a ride through our bloodstream, and if they find a cozy spot in our bone tissue, they make themselves at home. This can happen due to an injury, surgery, or even spontaneously. Now, these unwelcome guests can wreak quite a havoc. They can cause an abscess to form, which is like a secret hideout for these germs. This abscess can damage the bone and the blood vessels nearby. Over time, this can lead to serious complications, and in severe cases, it can even be life-threatening. So, osteomyelitis is more than just a fancy term. It's a serious condition that can affect anyone, at any age. Sounds scary, right? But don't worry. Understanding is the first step to dealing with osteomyelitis. So you may ask, what causes osteomyelitis and what are its symptoms? Osteomyelitis, a serious condition, can be triggered by a variety of factors. Most commonly, it's caused by bacteria or fungi that have managed to enter the bone. This can happen in several ways. Sometimes these microorganisms travel through the bloodstream from other parts of the body. Other times, they gain direct access to the bone due to an open fracture or a deep puncture wound. It's important to note that certain individuals are at a higher risk of developing osteomyelitis. Those with diabetes, for instance, or individuals undergoing dialysis are more susceptible. This is due to their reduced ability to fight off infections. Now let's discuss the symptoms. Osteomyelitis often presents with a fever, which is your body's response to fighting off an infection. You may also experience pain in the area of the infection. This pain can range from a dull ache to a sharp, intense sensation. Swelling, redness, and warmth in the area are other common signs. These are all indications of inflammation, which is your body's way of trying to protect itself and fight off the infection. It's crucial to pay attention to these symptoms. Osteomyelitis is a serious condition that requires prompt medical attention. Remember, early detection is key, so if you experience any of these symptoms, seek medical advice. Now that we know the causes and symptoms, how do we treat and prevent osteomyelitis? Treatment for this condition typically involves a combination of methods. Antibiotics are often a first line of defense, administered intravenously to ensure they reach the infected bone. The duration of antibiotic treatment can vary, but it's usually for a minimum of 4 to 6 weeks. In more severe cases, surgery might be necessary. This could involve removing portions of the bone that are infected or dead, known as debridement. If larger sections of the bone have to be removed, a procedure called bone grafting might be used to replace the lost bone. Pain medication is also part of the treatment plan, helping to manage discomfort while the body heals. And let's not forget physiotherapy, which can play a crucial role in helping individuals regain strength and mobility after treatment. Now, on to prevention. Good hygiene is paramount. Regular hand washing and cleaning any wounds or cuts can reduce the risk of bacteria entering the body. For those with infections, prompt and proper treatment is crucial to prevent the infection from spreading to the bones. If you have diabetes, good care of your skin and wounds is essential. This includes regular foot checks, as the feet are particularly vulnerable to infection. Lastly, maintaining a healthy lifestyle with a balanced diet and regular exercise can also help keep your bones strong and reduce the risk of osteomyelitis. With proper care and treatment, it's possible to recover completely from osteomyelitis. So that's a brief overview of osteomyelitis. To recap, osteomyelitis is an infection in the bone that can be caused by a variety of factors. Symptoms may include pain, fever, and swelling. But fear not, it is treatable and preventable. With the right medical intervention and good hygiene practices, we can keep our bones healthy and strong. Let's not forget, staying informed is the first step in prevention. Remember, knowledge is power. Stay informed and stay healthy.